Joined now by Republican Senator John Barrasso of Wyoming, who's I guess he's a member of the Senate's so-called non-existing working group on health care, but he is a member of leadership and he's the Republican Policy Committee Chairman. Senator Barrasso, welcome back, sir.
Thanks, Chuck. Thanks for having me.
Let's clear up the working group business here. Is there a health care working group or not?
There are a lot of groups meeting, but I chair the Republican Policy Committee. We had a discussion, a working group of 52 members of the United States Senate, all Republicans, today at lunch, where I chaired the discussion for over an hour, discussing the health care law, what we're trying to do to help the American people away from this disaster of Obamacare. Health insurance today isn't affordable, and fewer companies are willing to sell insurance. So we have a collapsing marketplace. We have to do something to help rescue the American people from what is happening with this law right now.
So this other working group, that was an idea that you guys have ditched?
Well, all 52 members are weighing in. You need 50 votes
Senator,
to pass
just tell me, has it been ditched? Has it been ditched? Is that you guys got bad PR and you ditched it? Is that fair to say? That other senators complained that they weren't involved?
No. What I'm saying is there are a lot of different groups working on this. All Republicans are going to have their say. You've known the Senate well enough to know that every voice will be heard and every voice is being heard, and all voices were heard from today. We're all focused on the issues that we hear about at home, which are skyrocketing premiums because of the health care law. People absolutely want to make sure that people with pre-existing conditions are continuing to be able to keep their insurance. But we have to do something now to rescue the folks where they're realizing that Obamacare is collapsing. We're seeing it in Virginia with companies pulling out. The same thing has happened in Tennessee. The same thing is happening in Iowa. It's not just that you're down to one choice like we have in Wyoming, which is very expensive, but in many places you're now down to zero choices. No one is selling Obamacare insurance, Chuck.
Let me ask you this. Are you guys going to start from scratch with your own bill, the old-fashioned way? You write a bill, you get the House bill, and you go to conference. Or are you going to start with the House bill and amend from there?
We're going to put our own bill together. It's going to encompass a number of things in the House bill. We're discussing what's in the House bill, how that applies or doesn't apply, but our focus is on patients and making sure that kind of the one-size-fits-all of Washington isn't what's in the future of health care. Different states need to do it differently.
Right.
What works in Wyoming isn't necessarily what works in New York City. We got to get it right for the whole country.
Cassidy Collins was the first sort of major Senate health care bill that was introduced. Senator Cassidy of Louisiana, Senator Collins from Maine. One of the things they said to me when I first interviewed them about this is, essentially, if you like your Obamacare, if you're a state that likes Obamacare, you get to keep it. Is that the goal of your bill here, that if you just brought up New York City, if New York likes what they're doing, are you going to have a bill that lets them keep doing what they're doing?
Well, that's all part of the discussion about what the best way is to repeal and replace a bill that we know is failing the American people, has caused skyrocketing costs. Even in New York, you have people who are on Obamacare, and New York Times has written about it. They can't get care. They have insurance coverage but can't find a doctor who will take care of them because of the narrow network. So you have people with higher cost, fewer choices. That's the problem. We want to make sure people actually get care. And right now, the Democrats seem to just want to pass the buck. We're trying to pass a bill, and we need all of our senators working together to find that. We have a committed group of senators, all of us as Republicans, who want to get something passed, get it conferenced with the House, and then get it to President Trump's desk.
Let me ask you a question. You described what you said is the problem with Obamacare now is you may get coverage, but you don't have access to a doctor. What did you think of the system before Obamacare?
Oh, no. I was practicing medicine then, Chuck. I don't say we need something better than Obamacare. I say we need something better than the system we had at that time, because there were all sorts of problems related to it. You know, and I'm a doctor that took care of every Medicaid patient that came to my office. We had an open policy on Medicaid patients, but even the Mayo Clinic a couple of weeks ago said, hey, when it comes to making appointments for patients, you know, we've reached a tipping point, they said, where if we have all these Medicaid patients, we don't have enough income to pay the doctors, the nurses, the people that take care of the patients, the people that do the paperwork in terms of their salaries as well as their benefits in retirement. So Medicaid is not the solution for everyone, and neither is Medicare. We need to preserve and protect Medicare for our seniors, and that's not going to be touched in any of these pieces of legislation.
Now, let me ask you about pre-existing conditions, because everything is in the, you said we are going to have a bill that protects people with pre-existing conditions so they can keep the coverage that they have. What happens if you lose coverage? What happens if coverage gets dropped and you have a pre-existing condition? Are these folks going to only be forced into high-risk pools? How are you going to deal with those? Because the whole point of this was to try to eliminate that bias from insurance.
As you know, under the current law, lots of people don't sign up until they get sick. And that's why we're seeing these skyrocketing costs and this collapsing insurance market, because only the sick people are signing up because they pay no penalty for not having insurance ahead of time. We want people to have insurance that's affordable.
The mandate. I was just going to say, though, but now you're... So
the most unpopular part of Obamacare
should we have a mandate?
Is the mandate that says everybody has to buy insurance.
But that's the only way to keep costs down,
You want to make insurance affordable enough. If you can lower the cost of care and insurance is affordable enough, then people stayed insured. If you read the article in the New York Times today about Warren Buffett's annual meeting, he said it is the cost of care that is losing our competitiveness in America in terms of the percentage of money we're spending on health care. And until you get the costs of care down, and as a doctor, I will tell you, we need to do more to get the cost of care down, that is the driving factor. Then you can get the insurance prices lower, and that involves patient responsibility, doing things to help staying healthy and being more knowledgeable consumers and shopping around when it comes to the care that they get.
I have to say, Senator, the cost of care, I would love to spend more time on that, because I agree with you. So many tests and paying for all of that. Do we over-test? But guess what? I'm out of time. I know I'm going to have you back, and I want to get into that as well. Senator Barrasso, as always, sir, thank you for coming on and sharing your views.
Thanks, Chuck. Thank you.
We bring in the panel.